Well, welcome very much to the Forum for the League of Women Voters of Marion and Polk County. We're talking tonight about the Children at Risk Early Learning, Early Intervention Study. And we're being recorded by both KMUZ and CCTV, so if your friends want to watch this and they're not here tonight, they'll have an opportunity to do that. I wanted to set the scene for a little bit about why it's important that we work with children at risk. So I'm going to invite you to begin with a video. Then I'm going to tell you after that a little bit about our Children at Risk study that the League did, and we've got some people from our Early Learning Hub here in Marion, Polk County to give you some details and answer the local questions about what you'll see in the video. This video is called Are We Crazy About Our Kids? It's part of a 4-series PBS program that will be airing next year across the country. What are we doing here in Oregon? What are we doing here in Salem? So we have some local folks who are here with us tonight to talk about that. Come on up. You two can share that one. Okay. And you two can share that. And I want to briefly start by saying that the League of Women Voters Education Fund from Oregon has spent the last 2 years figuring out what has been happening and what changes are underway in the state of Oregon. We've developed this study, Children at Risk, Early Learning, Early Intervention. And over the last 5 years, a great deal of legislation has had to be changed in the Oregon legislature to put in place the system that you're going to hear about today. You'll find the details of that in the study. There are cards on the back table with the link so that you can take that home, you can check it out, and there are many other interactive videos in the study in addition to the one that we've just seen today. And I think that as we go along, I'm going to interject other parts of the information that the League of Women Voters of Oregon found. But because we have 4 amazing people who can tell us what's happening in Marion and Polk County, we're just going to jump right in. Lisa, I'm going to get you to start, and if you will, kindly introduce yourself.
Happy to. All right. So good evening. Okay, I'll try and get really close. I'll try and use my best microphone skills, which I don't have many of those. So, as Chris mentioned, my name is Lisa Harnisch, and I have the proud opportunity to be the executive director for the Early Learning Hub here in Marion and soon to be Polk counties. And we are the Early Learning Hubs. How many have heard of the Early Learning Hubs? So a few, okay, so a few have. So that just read the report. That's great. That's fabulous. I'm glad to hear that. So we are part of the investment that the state is making in early learning, and it is really exciting to be a part of this transformation. So the early learning hubs are, again, part of that transformation in helping to ensure that we are providing the best opportunities for children and families, primarily from ages 0 to through the age of 5 or up to age of 6. And early learning hubs are about how do we come together as a community and as systems to better meet and better align the services that we provide. So it's bringing together early learning, child care, health, the K-12 or the school system, social services, business community, all wrapping around together to really look at what investments are we making locally in our communities to help ensure that, and these are the big 3, as I call them, that kids are more ready for kindergarten when they arrive, that services are coordinated and aligned, and that families are stable and attached. Those are 3 really big goals that we have in front of us. And I'm very proud to be part of a community who is very invested in doing just that, into really looking at what systems do we have in place and what can we be doing more of and what can we be doing differently to help change the trajectory for kids in our community. So that's why hubs came to be. And as I mentioned, we are currently the The legislation, just to back up for just half a second, the legislation put forward in previous legislative sessions said that we can have 16 in the state. And so there was a coming together of communities to say how do we align our geographic boundaries. And the legislature really wanted to take sort of a backhand approach to that. We were initially Marion County, and because it makes the most sense, we are widening our geographic boundary to also include Polk County, which is fabulous because many of our partners here in the Marion County area also serve children and families in the Polk County area as well. So it only makes sense, and I think that is just another indicator of the commitment that we have in our community. Hubs or early learning hubs, they're really bound by or focused on that collective impact. And that takes it even further than collaboration. There's a lot of collaboration that currently happens in our community. A lot of collaboration and working together amongst different either providers or different systems. And this is, again, kind of that look of like, how is it that we can really change systems to better meet needs? And so that's that collective impact, sort of looking at what are the resources that we have in our community, where are all the dollars that we're spending across the systems, and how are we investing those? As well as what can we be doing differently amongst the provider or the system groups like health and education. What can we be doing more of to help make sure that we're wrapping around kids and families? So as just a few initiatives that we have underway right now, and I should also just point out too, we are 1 year old. Early learning hubs are very new, so developmentally, we haven't even yet begun to walk. And some early learning hubs in other communities are just getting started. In fact, they haven't even finished their contract with the state, so we're pretty lucky in that regard. Some of the projects that we have going on that I know we're going to be hearing more of from my colleagues here is something around kindergarten partnership and innovation. And this is our community doing a better job in connecting early learning through Head Start, child care, connecting those earlier to the school system so that there's an understanding of what happens in the child care setting, or what happens in Head Start. How is it that we're assessing children, and what do they need to know when they arrive into kindergarten? So we're creating opportunities for that to happen. And also engaging families to schools much earlier than we currently have. So providing those opportunities for families to come to schools and take part in literacy night, for example. Providing opportunities for parents to attend parent trainings or parent education in the community, which then, of course, connects them to that school. So we're creating that firm foundation even before they arrive at the kindergarten door. We are also here in Marion County what we call a parenting hub. We received funding to bring more parent education, parent training into our community. Currently, we have quite a few different things that are happening through different programs, family building blocks, through our schools, and other entities are already doing some parent education, and this helps us to widen that so that we can provide more opportunities for families to learn how to engage with their children at a different levels, helping to bring in some of those early learning components, and really sort of normalizing, if you will, parent education. I know I, for one, as a parent, would have really appreciated some help in knowing what to do and different strategies. We're also working in partnership with Marion Polk Medical Foundation to work with doctors to give books at well child checkups and really impress the importance of reading and literature. And coming from a doctor, that's a really powerful message to send to families and to children, to say reading is important and reading is fun, and that's a thing that we need to have a part of that. The movie here today talked about increasing child care, or the quality in child care, and across the state we're doing a lot of work with our child care, both in centers and also in family child care. to really increase that level of quality so that we're building in the quality components and some like early literacy and early math and some structure to help ensure that kids have the skills that they need to be in kindergarten. So we're working with those child care partners to help them reach those what they call star ratings. Also, in connection with the healthcare industry, that has been such a fabulous partnership to work with our coordinated care organization. And how many have heard of the Ages and Stages developmental assessment? So a few have. So this is an assessment that families or doctors or other providers of services can work with families to take this Ages and Stages questionnaire. Sometimes you'll hear it as the ASQ, which helps families see where their child is measuring up to some different developmental milestones. And it also provides valuable information to help do some of that early referral pieces to help make sure that kids and families get what they need. So what we're doing in partnership with our CCO is where those questionnaires, or Ages and Stages questionnaires, are happening outside of the medical office, we're working to get that information to the doctor's offices in a very coordinated and expedient measure so that the doctors will have that tool so that they know, for example, in Head Start, they did the Ages and Stages questionnaire, and then the doctor can go over it and understand what's happening in the early learning environment, which is really a good thing for that continuity of care is very important. Other things that we're doing is helping to align curriculum that may happen in the early learning or child care settings, really putting some emphasis in making sure that the curriculum is aligned with Common Core standards. And so doing some training with child care providers if they choose to bring that curriculum into their practice. And then one other thing that I'll mention that we're doing that we're just getting ready to launch is doing some campaign and marketing around a tool that is free to families. And this is something that they can put on their smartphone, and they can plug in the name and the age of their child, and it will send out regular notifications to them to offer some suggestions on some brain building tips that they can do with their child, to engage with their child, and very simple, easy things that they can do, such as going when they're at the grocery store. Make sure you point out to Emma all of the things that start with the letter B. So it's simple things that you can do easily with your child, but then it has a brain building component to really help those neurons connect. So we're very excited about that. So if you start seeing Vroom out in the community, you'll know that that's a part of what we're doing as partners to bring that more to families. So I'm going to pause here, but that's just a snippet of some of the things that we have going on in our community, and very pleased to be joined by some colleagues who are helping to make this all come to fruition as well.
So let's switch to the other table. Phillip, maybe you can give us an overview of what's happening in mental health.
Sure. For mental health, I think we're really looking at increasing the highest risk population. So looking at parents as well as the child's attachment and attunement. So we've spent a lot of time going from 1 to 2 staff to 6 staff looking at early childhood and really looking at dyadic work. And so dyadic work meaning the child and a caregiver coming into sessions together to look at how in tuned and how attached one of them are to each other. And in relation to that, we've actually done a lot of things with Early Learning Hub and the community partners, I think, with the schools, is how do we connect earlier and get involved earlier in people's lives that are probably at the highest risk of having more problems down the road, not waiting until they're in special ed or that they're kicked out of school, but how do we get into helping other adults be in tune to their needs as well as not only the caregivers, but teachers work with them for 8 hours a day. So sometimes how do you get in there and work with the school? So our group works with parents, we work with schools, we work with THS. We're on several of the community action teams that the Early Learning Hub has. And so we're actively involved in how do we connect with the community. So that's all we do.
That's all you do.
That's all we do.
Okay. Stephanie, you're representing the early learning programs, the early childhood programs with Kaiser Salem Schools. So,
sure. I'm Stephanie Wetzel with Salem Kaiser School District. I coordinate our early childhood programs for Salem Kaiser. So my job, I think I've been in this position for 9 years. When I first began the position, we had about 120 students, ages 3 to 5, in preschool programs in Salem Kaiser. In the last 9 years, we've grown and we're just under about 1,000 students, ages 6 weeks to 5. So we're excited. The demand is really huge out there. Unfortunately, we have a waiting list across the board in all of our programs for families who would love to have access to services, but we don't have enough spaces available. This year, a couple things that have changed through our work with the Hub. Our Salem Kaiser School District now has a full-time P3 coordinator. So her job is to coordinate. The P actually stands for prenatal to third grade alignment. So what she's doing is working with our highest poverty schools and helping them to say, how can what we're doing with prenatal to 5 match up with what they're going to be doing in kindergarten, and how can we bring everyone together so that everyone's speaking the same kind of language and that we're all knowing kind of where we're going and how to get there. This month we had a training that was put on through support from the Hub and our P3 coordinator and our schools. We had kindergarten teachers, first grade teachers, our Head Start and preschool teachers and child care providers all coming together to do a training on early writing. It was pretty exciting. So it was exciting to have preschool teachers talking to kindergarten and talking to first grade and what are you doing and how can I help get my kids ready for that? So that's just a couple of the changes. We also are trying to do a better job of supporting families as they transition to kindergarten. It's a difficult time between the amount of support that families get kind of in a preschool world and then sometimes being thrown into an elementary, kindergarten to 5th grade school. So we've moved our kindergarten registration earlier. We used to not start that process until later in the spring. This year we moved that back, so we started it earlier. Each school is putting together a kindergarten orientation, inviting families into the building before the school year finishes, and really trying to provide families with enough support that they're needing to have this successful transition and really get involved in their school.
And this is the first year that statewide all children will be in full-day kindergarten.
Yes, we're excited about that'll be a big change for us is doing full-day kindergarten starting this fall.
And then, Stuart, you represent the Willamette Valley Providers Health Authority, the CCO, the Coordinated Care Organization in the area. And if I understand a little bit about CCOs, one of your jobs is to drive down the cost of health care. And you're rewarded for doing that if you find children early and you're able to provide interventions early. Does that help?
Yeah, I think that if I were to describe the CCO in the most succinct way, it would really mirror what Lisa already outlined with the early learning hubs. And that is, we're attempting to bring together multiple, at times, disparate organizations into one cohesive organization that can really map out long-term planning for the members that we provide services for. So in Marion, Polk County, that is a total of over 100,000 lives that we provide Medicaid services for, 40,000 of which are children. So to see a video like this, it really resonates as a provider. I think the basic tenets of what we're trying to do are to break down silos. So we're a young organization, just like the early learning hubs. We're about 2.5 years old. So we might not be crawling, but we're certainly still toddling. Our focus is on getting people together to have collective conversations that previously wouldn't happen prior to having a shared organization. So that's bringing dental providers into the same room with physical health, and so forth with mental health and addictions. Now, these things may seem simple and straightforward, but in fact, those conversations were not taking place as recently as 5 years ago. So to bring this back to early childhood health, we've been doing a lot of work with developmental screens. And that is essentially a process to identify developmental delays amongst children ages 0 to 3. Now, this is a topic that's of interest to a lot of different organizations and across a lot of different systems. The healthcare system has been focused on it for quite some time, as has the early learning system. But unfortunately, those two systems have not always been able to approach it in a uniform way. So what WVCH has attempted to do in conjunction with the Hub is to give early learning providers and physical health providers the tools that they need to document screens that are taking place within the community and share the results with one another. Because one, that'll reduce costs because we won't have duplicate screens taking place. And two, we'll make sure that those that do need to receive services get the care that they need and everybody's on the same page.
And Stuart was talking about silos. If you grew up on a farm, you think of the silos as those big stacks, and you look across the farm landscape, and there are quite a few of them. In the language that they're using, not only is he breaking down the silos between the dentist and the pediatricians and others, there's also an effort underway to break down the silos between healthcare, even at the state level with the Oregon Health Authority, and DHS, here locally, the Marion County Health Department, but many other human services providers, and then within education too. So there are 16 hubs across the state. 14 of them are operating. The other 2 are just coming online. And what we hear consistently is, as I talk to people like Lisa in other parts of the state and say, what's different now? What has actually changed in the last several years as this structure has gone into place? And very frequently it is that we're talking to each other. We all used to be in our own little silo, doing our own little thing, providing services to the family, and then they left and they wandered around until they found the next silo. And they got some services there, and then they looked around and they said, I wonder what that silo over there does. I'll go check it out. And so the goal is that families can go to any door and be able to, from there, open and have services that they need. You know, we talk about children at risk, and traditionally we might have thought of that as being children who needed special education, or children who were in foster care, or perhaps a child who had special medical needs. But in fact, the legislation that was put in place in 2012, upon which much of the rest of this is building, defines children at risk in a very broad way. And I'm going to read this, and then I have a question for Phillip about why all of these pieces go together to help. A child at risk can be defined as someone who is not ready to enter school due to factors including but not limited to living in a household that is at or near poverty, living in inadequate or unsafe housing, having inadequate nutrition, living in a household where there is significant or documented domestic conflict, disruption, or violence, having a parent who suffers from mental illness, who engage in substance abuse, or who experiences a developmental delay or intellectual disability, living in circumstances under which there is neglect or abusive caregiving, having unmet health care and medical treatment needs, and having a racial or ethnic minority status that is historically consistent with disproportionate overrepresentation in academic failure. Phillip, what does that describe?
I mean, I think it describes if basic needs aren't being met, people aren't able to actually do more. And I think when we're looking at the silos being broken down, we're really looking at how do we get basic needs met across the gamut. So I think the CCO, the Early Learning Hub, the counties, the schools are really looking at how do we provide for the whole needs of the community, actually. And I think that that's the bigger picture is we're really looking at how does the community come together to support our youth moving forward. So are we crazy about our kids is actually a great statement, because I think there are more people looking at how do we provide for the child and family, not necessarily just for the child. So when the child's basic needs aren't met, they're not able to actually sit and learn. They're hungry, their brain's not developing. Some kids learn not to cry for help because there's nobody coming. So they're not going to learn how to meet some basic emotion regulation. So when they go into schools and they have a need that needs to be met, they don't know how to do that. And so schools see them as sort of withdrawing or feral child that's in the corner or depressed. So I think we put all those labels to small children early on due to sort of their environmental circumstances. And so I think with the Early Learning Hub and the CCOs is how do we get everyone to identify that a little bit earlier to sort of help families along the way. So.
And Stephanie, within the Salem-Keizer School District, love these mics, aren't they awful? Within the Salem-Keizer School District, not every child is eligible for those prenatal to 5-year-old programs. How do you determine which children have access to those services?
And we do actually have some programs that are kind of fee-based and anyone could enroll in them. So what we try to do is have enough programs or options available that families would find something that would meet their need. So whether they're enrolled in, Willamette ESD in a specialized preschool for their needs, whether they're in a Head Start program, whether they're maybe aren't qualified for Head Start, but they can provide, pay for a fee-based program. What are the best options we can provide so that our goal is that every family could have some type of a space available to allow their child to access early childhood education services. That's our goal.
And John is not with us tonight. He heads the Community Action Head Start and Early Head Start programs. What is the eligibility for those programs? Anybody want to speak to that?
Sure. So for Head Start, we follow the federal poverty guidelines to qualify as income eligible, which are really low. So they're free lunch is above kind of the federal poverty guidelines. You can't make very much to qualify for Head Start program. So we enroll families who are at or below the federal poverty guidelines. We also enroll 10% of our students need to qualify for early childhood special education. So we make sure and have spots available for those services. We also encourage families to apply. I encourage anyone to apply who think they might be interested, because sometimes families may have a variety of other risk factors that can help them qualify, whether it's mental health issues, drugs and alcohol, language needs, no access, parent education levels. So we look at a variety of different factors to realize who is kind of at the greatest need for these services.
So within Oregon, over the last 5 years, we've been building pieces of this system. There's still a great deal of work yet to be done, and there are pieces of legislation that's happening right now in the 2015-17 legislative session as well that is looking at other pieces such as strengthening those pre-K programs, raising that poverty level for some of those services from 100% of poverty to 200% of poverty. And yet, money is always an issue. Now, within the hub, you did some early work to figure out where the pockets of needs were the greatest. And how did you decide where to spend your limited resources and time, and where are those pockets?
Yes, thank you for asking that, Chris, because that was something that I neglected to point out. So when Marion County was getting together and sort of looking at, knowing that we have a very limited amount of funding, and looking at the data of our county, we looked at things such as poverty, the kindergarten assessment scores, which at that point were in their very first year, and also at third grade reading, and then English as a second language, or what our diversity rates were. And so looking at those four specific things, then looked and using the schools, because that's sort of that neighborhood connector. Even though the children and families that we're working with, or at least the children that we're targeting, aren't necessarily attached to that school, we know by virtue of where they live, and being able to pinpoint. And so we looked at, I've identified 16 catchment schools in the Marion County area, so 9 here in Salem, all 4 elementary schools up in Woodburn, 1 in Jervis, and then 2 in the North Sandy Am School District, so Staten and Mary Lynn. And identifying that those schools have great need. Doesn't mean that there's not great need in other schools, because there is considerable need. But knowing with the limited resources that we had, that those would be our targeted areas. There are things that we're doing that are outside of those areas as well. So when we think about some of the communications that we will be doing, when we think about the developmental screening tools and getting that to the doctors, those are not necessarily within those neighborhood geographic areas, but that's primarily where we're focused.
And Stuart, one of the statistics that really struck me was that only 32% of children under age 6 receive a developmental screening in Oregon during 2011. We hope that we're changing that now. But during that same time period, 90% of those children saw a doctor. So it seems like a wonderful partnership between children and family providers.
Yeah, I think that we're already seeing a substantial amount of progress on that front, in that when CCOs were developed in 2012, our baseline screening rate was under 20%. We gradually saw that rise up to just about 30, and now we're approaching 40, and I expect by the end of 2015 we'll be around 50. So we're making a lot of headway, and a lot of that, I think, is just engaging community members to find out where these screenings are taking place that we were not already aware of. So I can tell you, if the CCO says 40% of our kids have been screened, there's probably close to twice that out in the community that's actually taken place.
And how are you motivating physicians and nurse practitioners and other healthcare providers to provide the screenings? They're very busy. What incentive do they have to provide the screening?
Typically money and shame. We do 2 things. We attempt to hold every physician accountable for their performance on a core set of measures which we believe will help improve the health outcomes for the members that are on our plan, one of which is a developmental screening. So every physician receives a report to see how many of the children assigned to their clinic have received a developmental screening within the time frame that is appropriate. That's ages 0 to 3. There are monetary awards that help boost the incentive for them to comply. But there's also a bit of competition for them to look at a chart and say, Dr. Johnson is at 70% and I'm only at 35, and we have the exact same tools. Doctors are pretty competitive, so that works to our advantage.
Sounds like motivation in any form you can find. So in just a few minutes, we're going to be taking your questions and sharing them with the panelists. And Deanie's going to pass out some cards. Because we're being taped, I'm going to read the questions so that our viewers later will be able to hear them as well. So, Deanie, please pass them out, and we're going to continue our conversation up here. If you all will raise your hand when you have a question on your card, then they'll bring them up, and we will share them. Now, and back to those kids in getting services, and I think that in 2013, only about 50% of children who were eligible for pre-K services received them. What's happening to increase those numbers?
I think part of that could go with the work that our hubs are doing, with the continued advocacy at the legislative level to say we need to increase the amount of funds that are available for early learning. So we're continuing to demonstrate that the need is there. We have families who are applying. We have families who are sitting on a wait list. We have families who are calling every day. And we want to continue to speak to that and say what can we do so that there is a spot available for any family who's interested.
I would just echo that. I mean, it is in part what we're doing is to demonstrate to the legislature that there is great need and a desire to have these additional opportunities for children. So absolutely.
And OHSU has a Center for Research. The director of that program happens to be Pam Curtis, who also chairs the Early Learning Council. So there's been a tremendous push to be able to figure out exactly what is the return on investment in Oregon. Whenever we invest in early childhood education, early interventions, what are those returns on investment? The number that we're using right now is about $8 to $1. It's probably low. That's something that's very easy to document. I think that we'll find that number goes up as we get more numbers to be able to see what those preventative services do. Now, we're talking today about what's going on in early learning, but there's some very exciting things going on also in the human services area in the foster care arena. There's another connected program called Pay for Prevention that is in its early stages to be able to figure out what are the risk factors that would bring a child into foster care and what can we do early to identify those pockets. And we actually have a map now across the state of Oregon about where those pockets are, and working to be able to provide services to families early to prevent the children from entering foster care in the first place. So that is what's happening in human services. You've already heard a little bit about what's happening in the health authority and CCOs, what's happening in early learning. And so all of these together reach the families in different ways than if they were in those silos. Then what's very interesting to me this year is I also wear a hat for the League of Women Voters as one of the action team of legislative lobbyists. I love going to the store and telling people, I'm a lobbyist. And they step back. That's a bad word. And then I say, oh, for children and family, safety net issues and social policy. Then they melt. But indeed, what I am seeing is a great deal of cross-pollination in the legislature, writing into the law that there will be partnerships between the Department of Education, the Early Learning Division, between CCOs, the Oregon Health Authority, the Department of Human Services at both the state level and at that regional hub level and at that local level. So up until this point, as the hubs have been reaching out, it's been a matter of goodwill, being able to persuade everybody that this makes economic sense. But there will also be that opportunity to have it written into the law, and everybody gets evaluated by what they do to work together. I think we have some questions now. You want to bring them on up? Thank you, Jeannie. Thank you, Diana. Okay, how is the business community involved in the hubs?
Good question. Good question. So that is an area that we don't currently have board members that represent the business community directly. However, there is great interest in what we are doing, and we're connected through the business community through a couple of different ways, primarily here through Salem by attending various networks and different network opportunities to talk about what we're doing here in early learning. As we are embarking upon a communications and sort of marketing, that's where I feel like the business community is really going to be one of our best allies in helping to reach families through various messages that we want to put out into the community. And then also some investments that can happen from the business perspective, sort of bringing that in. The other way that the business community is involved is through childcare businesses. There are childcare businesses that are run either in the home or in as part of centers, and they are very much involved in the creation of the early learning system or the transformation of that through increasing quality to make sure that kids are in quality environments.
And I'd like to sing the praises for a few people. Many of you know Dick Withnell. He's quite active in the Salem community, and he has been very, very active across the state in helping to make the transition from the county's commissions on children and family to the early learning hubs. Dick made his money in the auto business. He does a great job of being able to talk to other people. I've asked him if he'd like to hit the road with me so that we could do the dog and pony show of Are We Crazy About Our Kids to the local chambers of commerce, to the Rotaries, to many of the other leaders. And the Oregon Business Association has been very active in helping to look at causes of poverty and looking at ways to provide prosperity. So the business people are indeed an active player in that. Stephanie, this is a question for you. Given all the various at-home languages, we tested them all before we started. So that was much better, isn't it? Stephanie, given all of the various at-home languages in the Salem-Keizer schools, how do you reach or identify children for the early learning programs?
That's a great question. We work through that in a lot of different ways. So sometimes it may look different depending on the language or the area, but we try with our recruitment strategy to go get the word out in a huge number of ways. One way is through local churches. We also work through our TANF list where we partner with them for families who are qualifying for the Oregon Health Plan or who are receiving assistance to make sure they are receiving word. Our school district right now serves students with over 20 different languages. So we have translation services. We're lucky being an early childhood program that's within a school district that we have access to those services. So not only do we have kind of the Spanish support, but we also have Marshallese, Russian, Vietnamese. We were doing Korean and Arabic and making sure we're getting, reaching all of our families in our community and really trying not to exclude anyone if possible. So that is a huge issue and a huge need that we're seeing. We're using a lot of different strategies for recruitment to get the word out, but some of those language needs are very unique, so trying to meet that in the community.
So here's a question. Is anything being done through the hub, perhaps, about connecting for prenatal care and offering help to mothers who already have children who are underachieving?
So yes, absolutely. There is actually some work that is happening in conjunction with the CCO to really look at what is happening for moms before they give birth, and then also what happens to with a mom after they give birth, so that there's connection to the right level of services that will help them. So we're doing some work to really map that out so that we can better understand where families are and where we can better meet their needs and make sure that we're catching them in a time of need to help make sure that they have what they need. And then also, as we're focusing from a health perspective, sort of looking at that very multifaceted, when we think about physical health, when we think about nutrition, when we think about mental health, and making sure that we're looking at it holistically.
So this mic is coming your way anyway, Stuart. How are CCOs funded? And when you finish that, the question for you, Lisa, is how are hubs funded?
CCO funds come directly from the state. So I'm not an expert on state fiscal policy, but that's how we get our money.
All right, and so likewise, our funds are legislatively approved. So right now, as part of the education budget, that's where our funds are allocated. The first year, and we didn't mention this earlier, but the hubs are actually technically in that testing or that pilot phase. So there were funds that were set aside for that. Some of you may remember the Commission on Children and Families. So some of the funds came from what was the Commission on Children and Families system. And so each hub has an allocation based on their per capita child income, or per capita per child. So those are what we call coordination dollars. Our hub then is additionally funded. We are very fortunate to have an additional 4 different grant streams to help with some specific projects. And most of which I mentioned here today already, like the Kindergarten Partnership and Innovation, the Literacy Fund. So we actually had to apply for additional dollars to bring into the community, and that's really a part of the role of the hub. We're here as a coordinating and collaboration and a catalyst function. That's really what we are, and looking at different funding streams and working to bring additional ones in partnership with the community.
So this question is, what about autistic, dyslexic, bipolar children? Are they continuing to receive services that they need?
Yes. Well, a lot of those diagnoses are actually quite early for the 0 to 6 population. So, but the autism one isn't. And so I think that ASQs get to that. The more people that we're coordinating efforts will help that as well. So I think that people are looking at intervening earlier and not waiting till the 3 or 4-year-old. So people are identifying it in infancy and sort of helping families go along the way. So I think those efforts are being coordinated a lot sooner than they were 3 years ago. I think there's a lot of providers that are helping each other navigate that a little bit better. There's a lot more support for families. I think Lisa talked about sort of looking at the parenting classes. I think parenting classes is still a stigma in relations to I must be a bad parent if I'm taking a parenting class, or only referring parents who are having difficulties. On the mental health side, we offer a lot of Autism 101. So we offer a lot of psychoeducation about mental health diagnoses, not only for the children, but for the parents as well. Depression from moms leads to lots of neurological stuff for the children. And so that psychoeducation also is helpful to parents as well. And I think there's a big effort on the maternal side to look at how do you get that information to mom and then reinforced again by the mental health side for the children.
And at the state level, there is still a separate pot of money for early special ed programs and children who are medically fragile in other ways. So that is not completely blended into this program. And that leads to the next question. How do Head Start preschool programs compare with the state-of-the-art preschools, such as the ones that we saw in the video in Quebec or others piloted in the U.S.? I'll start that question, and somebody else can jump in. Head Starts are marvelous programs. They have had many, many years of testing and evaluation, and they are funded in such a way that that money comes from the feds through the state, but directly to Head Start organizations. So that service is coordinated through the early learning system, but stays separate for Head Start. And as this whole program was going into place here in Oregon, there was a concerted effort to keep the Head Starts. The federal funding system, for one, requires that they stay separate, but also to take the best parts of Head Start and blend it into other early learning programs. Stephanie, you want to add anything else about Head Start?
Sure. I would just say that we want our classrooms to be, I tell folks, I want our classrooms to be the best in the state, the best, just model classrooms for what an early childhood classroom should be. I don't want someone to, where someone would say, hey, walking in that, oh, this is a preschool for low-income families, right? So I want our classroom to be really amazing. So you're going to find high-quality materials. You're going to find things that look like they're in really good shape. So new furniture, the room is going to look very clean and have enough materials for the number of children that we have. Another good thing about Head Start is that they set aside money, or programs are required to keep money aside for professional development. So our staff are able to continue to access training ongoing, and that kind of to continue to bring in best practice and research-based and updated materials and curriculum. And we know that children learn through play. So making sure our classrooms reflect that and reflect to give kind of a variety of experiences for all of our kind of youngest learners. But I would invite also, if anyone wanted to take a peek or, to look in what a preschool classroom looks like, they're more than welcome to kind of do that. But we spend a lot of time focusing on the environment because we know children learn through the environment.
And I'm looking at the clock. You all have been very attentive listeners and very, very active panel members. We're going to call a stop to the formal part of our program. Let's give a hand of applause to our presenters.
Here in Salem as much
I
as
thought
I can,
every
because
American
Salem
would
is my
want,
home
which is
base.
a little common sense government.
American, young, old,